Well, it's one of the hardest hit areas in the country by coronavirus, the Navajo Nation. It was under yet another curfew this weekend to stop the spread. Tonight, we introduce you to a former college athlete from ASU who's witnessing this crisis firsthand, and Whitney has the story.
Yeah, Spencer. So at one time in her life, Dr. Michelle Tom could be found on the basketball court at Arizona State University. Now she's on the front lines in the fight against coronavirus, working in Winslow, where she went to high school. I got a chance to catch up with her this week in between her 24-hour shifts at the hospital.
As a point guard for the ASU women's basketball team in the late 90s, Dr. Michelle Tom learned a lot about teamwork. Now that's being put to the test in a way her generation has never seen.
You have to work as a team. You have to work as a team for the ultimate goal. And so learning those things and knowing what I'm good at or what I'm weak at, a nurse is phenomenal at.
Leadership, coordination, cohesiveness. Lessons from the court have translated into the medical field. Right now, Dr. Tom is working at these two facilities in Winslow. One is a hospital, the other an outpatient clinic. In a rural setting, she has to be a jack of all trades. Every day at work, Dr. Tom dons PPE, which she says can be a challenge to get right now, and comes in contact with at least one COVID-19 positive patient.
A lot of these cases, they're feeling okay, and the next day, they're not breathing very well.
Growing up on the Navajo Nation, it was important for Dr. Tom to return to work at home so she could really connect with patients.
Giving them comfort is a huge thing, especially now when I have to speak to an elder that's in the hospital who only speaks Navajo that I can. And they can't see family, right, because there's no visitors.
Because she could put her family at risk, Dr. Tom has to live away from them for right now. She has a public Facebook page, and her work has gotten national attention. Dr. Tom's message for all of us: wear a mask, wash your hands, and practice social distancing.
I see healthy people, young people who have lost their battle with COVID-19. This is something I have not seen in my training, and nor my colleagues. This is real. This is taking lives of people who should have lived decades longer.
Like I mentioned, Dr. Tom is temporarily living away from family. She's in Flagstaff. She has a roommate who's actually also a doctor who she says has really been her rock right now. They've made a pact to take care of each other and regularly do mental health checks after those long, exhausting days.